Hello and welcome to Salem Voices. I'm Lucy Rose, your host, and I am so excited today to introduce our special guest, Hanan Abdul Rahim. And she is coming to us from her home in Doha, Qatar, which I really, really love. It's so fun to do international ones. So I just want to say welcome. I'm so glad to have you. Thank you.
Thank you. I'm thrilled to be with you.
Yeah, and especially with the time difference, it's especially cool. For me, it's 9 o'clock in the morning, and for you, I think it's around 4 o'clock in the afternoon as we film this, right? At least it's the same day.
Yeah, exactly.
And you finish your day, and I'm just getting started with mine. But I have to say, I just can't wait to talk with you today because everybody's going to be quite interested in what you do. So as we kind of get going, I do this little 5-minute exercise. You were a senior at Salem College. You are now Dean of the College of Health Sciences at Qatar University, which is remarkable, and what a journey. In 5 minutes or less, and that's a tough question for you, not really, but can you please tell us how in the world you got from being a Salem senior to where you are today? What's happened in between?
Right, so a lot happened in between. I graduated from Salem College in 1992 with a degree in biology. And then I went to Illinois State University and I got a master's also in biology. I went back to Palestine, which is where I'm from, and I started working for Biarritz University. And then shortly after, I got a scholarship to get my PhD in epidemiology at the University of Oslo in Norway. So I did that, and then I was an assistant professor at the same university until I came to Qatar in 2008. And so I've been here for about 13 years now, and here I am.
And there you are. You did that in faster than 5 minutes. I think that's well done. The academic part of you is coming out in a very different way right now, being able to do it faster, right? I love that. All right, so you got
to the point.
Exactly, I love it. You have 2 advanced degrees, clearly. How did they come together? Now, your master's degree is in biology, which is the same as your undergraduate degree. Bumped up a notch on steroids, I guess, is what you probably did. But the fact is, how did they come together to help you be what you are today? Kind of how do they inform and guide your work and your impact? And we're going to get into a lot of that in depth, but just in general.
Right. So, when I was at Salem, I really, really liked biology. I enjoyed it very much. I liked all of my classes. And that's why I decided to major in biology and minor in chemistry. And I liked it so much that I went on to get a master's also in biology. But I think then the way that led to the epidemiology and then to the work in public health is combining that basic science background with a liberal arts foundation. Because, public health is all about looking at the broad determinants of health. And so I found that I really enjoyed that. And I found that it was a really good fit between a good understanding of basic science, which really helps you understand the foundation of health and disease, but then you overlay on top of that all your interests in larger determinants, which something like, a foundation in liberal arts really prepares you well for. And that's how it all led together to the epidemiology and to the public health.
Okay, I'm going to stop you just for a second because I hear all of that coming together, and I too majored in biology, just as a little secret from Salem. So Wonderful. It kind of stuck with me too. And I just love all of the natural world and what it is.
Absolutely.
But as we think about epidemiology, could you, since you have your PhD in epidemiology and it has kind of guided your career a lot, and a lot of your interest areas obviously lie in that area, can you describe for everybody listening what epidemiology actually is? When you say you have a PhD in that, what does it mean? They're hearing it a lot these days also with COVID-19 and things.
Exactly.
So yeah. What's epidemiology as a study?
So epidemiology is studying where disease happens and why. And it's not really just disease, it's all kinds of health related events. So, in what populations does it happen and why? What are the risk factors? What are the causes, et cetera? And of course, that's a really understanding that and knowing that is a really good foundation then for taking action, for interventions, for planning, really sound evidence-based interventions. So it's, in a way, it's the science of public health, if you will.
Yeah.
So I hope that was a good explanation.
Oh, it's a great explanation. And I always, when I think about epidemiology, I think about also things like finding that very first case, the index case or whatever, and what that looks like. So you can draw the conclusions you need to as to how it's spread and what has happened and what's the origin and all that cool stuff. It's kind of the detective in me coming alive to think about epi. But Yeah, it's
Oh, very much so. I
yeah.
think a lot of people who know about epi or who think about epi think about it in infectious diseases and, disease outbreaks and investigating cases. And
Yeah.
certainly that's been, a very, very important part. Certainly it's an important part of how we're dealing with COVID now. But the nice thing about epidemiology is it gives you really nice tools to study not just infectious diseases and disease outbreaks, but also non-communicable diseases, which all over the world now are, such an important burden on populations. So it's really nice in that it gives you tools to look at all kinds of health-related events. And I want to say that I think the reason that epidemiology clicked so much for me is it's really not just a discipline, it's a whole way of thinking, right? It's a whole mindset. And I really, really like that. It trains your thoughts. It trains how you look at things in that, if you think about concepts that we deal with in everyday life, like bias or confounding, these are really essential parts of what we study in epidemiology. And yet, they're very, very salient in our everyday lives. So I really like how epidemiology trains you to think about anytime you're making a judgment, to think about what could have been biasing that judgment and how to deal with that. So I like it. I love it.
Yeah, you can tell. And I love it too. And I just love your face lighting up as you talk about it. If only everyone could do what they love the way you clearly love yours, we'd all be a happier population, wouldn't we? I love that. Way to go.
It's really important. I can't imagine, going through a career and working at something and everybody works hard, but to work hard at something and not to really be passionate about it, not to love it. I mean, that's just, that would be unfortunate. And I'm so grateful that I get to do what I really like.
Yeah, you are so fortunate to have carved that out for yourself as well. But that's partly knowing yourself and what makes you excited about doing it as well. I'm going to push on one more thing because you mentioned the liberal arts aspect and how important that was. As you think about epidemiology, it's kind of that perfect intersection of the need for science, but also the need for understanding people and the critical thinking and how all of this problem solving, critical thinking, kind of how all of this comes together. How would you say your liberal arts has informed you in terms of your science and decision making as well along that way?
Oh, enormously, enormously. I think the thing that we really need to appreciate about the liberal arts is that it makes you a much more complex thinker. It really makes you go beyond the surface and dig deeper and think about interrelationships, right? And just have this really holistic perspective. And if you think about it, all kinds of problems in the world, I tend to be more interested in health problems, but any problem we think about is really quite complex. It's not a one-to-one. It's not one cause and one effect. It's really multifactorial. It's quite complex. And I think when you come from a liberal arts foundation, you really have an appreciation for complexity, and you have an appreciation for what every single discipline might bring in to solve a problem. Because after all, that's what you want, right? You want to solve a problem, and you should be ready to use whatever tools are needed to do that. And I think the Liberal Arts Foundation really makes you appreciate that very much.
And I think that's really, really salient coming from you, who's the Dean of the College of Science, Health Sciences, actually, also be talking about the liberal arts aspect of this. And of course, as Salem is transforming into a health leadership focus, we're going to maintain a real focus also on the liberal arts. So it sounds like we're in total agreement here about, in terms of what Salem is doing and what your thinking is as well about how to put
that's why I was so excited to read about it. I thought that was just such a certainly innovative and creative, but also just very logical kind of move, an excellent transformation. I was really excited to read about it.
Okay, well, thank you. And speaking of Salem, I'm going to just take a little bit of a 180 turn right now and ask you, and it's a little detour, but I think it's a fun detour. How in the world did you get to Salem? Okay, so you weren't living even in the United States, I think. So what made you choose Salem College?
Well, I knew I was coming back to the US for college for sure. And then my guardians at the time were living in North Carolina, and their daughter was going to Salem Academy. And so I came and I visited Salem College, and it was just love at first sight. I loved it. I felt right away that it was the right place for me. And, that was it. That was it.
So was it the right choice? And what would you say are the most important lessons you learned about life and work while you were there?
Absolutely the right choice. I mean, if I had to do it over 100 times, I would.
Wow.
Absolutely the right choice. Oh yeah. It gave me such a good and firm start, I think, to my career. And I mean, I can think and talk about a lot of really wonderful things that I encountered at Salem, and just, whether it's the learning or the friendships or, everything that I enjoyed about it. But I think the one thing that was really, really important about the way we were at Salem, and I'm sure it still is building that foundation of self-efficacy, which is so important for young women, going forward in their lives and in their careers. I mean, everything is important. Your training, what you study, what you do, your preparation, everything is important. But without that foundation of self-efficacy, the feeling that I can do it, the belief in yourself that you can do it, I think it's much harder and quite possibly not even possible. So I think that's what I really take away the most. And it's so easy to remember. I mean, when I think about it now, it's been, decades since I graduated, and that feeling doesn't go away. And so when you say Salem, that's really the first thing that I think about.
Whoa, self-efficacy.
Yeah.
When we talked before, I told you, for me, that was just one of the most interesting terms I have ever heard. So I'm going to ask you, you mentioned, you defined it just a second ago. If you could do that again, just briefly. What is self-efficacy to you? And what did Salem do specifically and specially to help you develop that within yourself?
Right. So self-efficacy is the belief that you are able to do things, right? So the belief in your ability to do things. And just think about it, even in the way, even now in the way I raise my daughter and the way I deal with my students, I find it so important. The basis of everything, I think, to first start with that belief, and then, to go forward and build on it. And it's just everything I encountered at Salem from day one, that feeling that there is nothing you cannot do. What is it that you are interested in? What is it that you want to do? There's nothing that you cannot do. And it's a very, very powerful message when you're young and just starting out. So that's what I take away the most, I think.
I just love that. And I really am listening and taking away this self-efficacy thinking, because I just think it's such a beautiful term to describe that feeling of confidence, the yes, I can, and watch me, you know what I mean? That is so important, you're right, to build in all of us. But I just love the concept and the thinking about that, and the thinking you as an academician would appreciate this. How do you intentionally design programming to enable folks to really gain that self-efficacy? What does that look like? That'll be interesting, I think, to explore as we make this transformation and really focus even more on leadership and what that means and what that looks like.
Absolutely, absolutely.
Well, and you've had quite the leadership experience yourself, clearly. Qatar recruited you. You came in as a teacher there, as a faculty member, and have quickly risen through the ranks all the way now to being the dean of the whole School of Health Sciences. So what attributes would you say you possess that have enabled you to rise to these leadership positions? And how do you lead or inspire your faculty to constant improvement? Because clearly they're two kind of different things, but totally related.
Well, I mean, it sounds a bit cliche, but first and foremost, I think I have always loved what I do. And I think it shows when people interact with me. I think you can tell that I like what I do. And I love teaching. I've always been in universities. I love the university. And that's really important. So to go about your career, joyfully and appreciating everything positive in it. I think that's just that's a wonderful motivator for me. I think what I try to do, I mean, I hope I do it. I hope my faculty think that I can do it, is I try to make sure that everyone is seen and heard. Because if you if you think about it, I mean, every single interaction that you are in, whether it's with a student or a faculty member or, you know, or anyone that you are dealing with, it's never a one-way street. I mean, you know, people come to interactions with expectations and with biases and with beliefs and with intentions and with things that they want to achieve. And it's the same for, you know, for everyone. And so being able to really hear what that person is saying and to kind of see what the interaction looks like from their perspective and to understand what it is that would constitute a win for them, what it is that they're hoping to get out of this interaction, and seeing how it aligns with what you want as well, and trying to find that ground where what you want and what the other person wants align. And I think that's something I try to work very hard at, because I think when people feel seen and heard and appreciated and understood, honestly, even when you're disagreeing with people, I think just, you know, people knowing that and knowing that you've made an effort to understand them, that really does go a long way. And that served me really well in my career. And I really try to intentionally always approach things that way.
So it's more than just listening. It's really understanding what inspires and motivates others, and how I think I'm hearing, and I'm just trying to redo this, inspiring others by showing them that you care, that you are listening to them and trying to find that best fit in one respect for them, but also in how what you're doing is going to impact them and help them be better at what they do, or make the school better at what it does, or whatever. Those are really special skills that a lot of people, I think, don't think about, but it's basic human nature, isn't it? What's in it for me? And is somebody really caring about me being the best I can be? And if so, I'll probably rise, you know, to make this work. Yeah.
Absolutely. I think every single person brings something to the table. With some people, it's more obvious than others. Like with some people, you know, when you first meet them, you can tell what their skills are or what they bring. With other people, you have to dig a little deeper, but all the same, you know, all the same, everyone brings something. And when people feel like they're allowed to, or they're able to, or they're supported to, you know, to be the best at what they can be really good at, I think that just brings out all kinds of potential, and people are happier and they're more productive, and, you know, they do what they want to do. So it's really important to extend that understanding, which you're right. I mean, it's more than listening. Listening is certainly really, really important, but it's also beyond listening. It's really just also trying to be in that person's place and to see what they need out of this interaction to work.
Okay, thank you. Thank you for your insight. All right, I'm going to actually read something from your resume, because there's no way I can kind of like put it in my brain here and ask you this, because I want to be a little bit specific. I noted on your resume that your research interests are at the intersection, you can see why I'm going to read this now, of social science and public health, with a special interest in the social determinants of non-communicable diseases, which is why you're talking about infectious versus non a few minutes ago, and in the health and well-being of women, which obviously is exactly kind of where we are again as we move Salem. What kind of projects have you worked on? Might you be working on now? How does that translate into your real life work? Because you're also highly published. I wish I could actually show your whole CV, but you've written a lot. You've done a lot of work in these areas. Tell us about some of it.
Thank you. Yeah, so again, it's the Liberal Arts Foundation. It's bringing together the social science and public health and trying to understand, you know, what makes women healthy and what affects their well-being. And I tend to have more of an interest in women, but I have, you know, studied different populations as well. So I started out, you know, in women's health. I especially around pregnancy, cesarean births, maternal and child health, quality of care, et cetera. And I've kind of come back full circle to it. In between, I've also looked at other populations, but right now I'm back to looking again at the mental health and well-being of pregnant and perinatal women. That's a specific interest of mine. And now in COVID-19, I'm working with other colleagues on a project looking at the health and well-being and resilience of healthcare workers. So that's really always been my interest, is to look at the macro factors that determine health and well-being and functioning.
Okay, so as a researcher who's interested in these areas, which clearly are very cool and very pertinent and very timely right now, as they always are, but especially now, I think they're on the forefront of kind of everybody looking at them. As an epidemiologist, do you kind of define the problem and try to fine tune what the problem is so we know more? Do you go as far as talking about potential solutions and what to do and how to make life better for these folks and where we should all go and be thinking? What outcome kind of are you looking for in the studies that you do?
Right. So, I mean, that's really the beauty of epidemiology. Again, and that's how it fits very nicely with broader public health work. It gives you the tools, and it depends on what you need to do for that particular issue. So sometimes what you need is to define the issue, to say how prevalent is it, how big is this problem, where is it happening, in which populations, who is affected most, right? This is a really important issue. So it gives you the tools to do that, but then those same tools you can also use to evaluate interventions. So say you identify a health problem, right? And, in public health, you don't treat with medicine, you treat with policies, with interventions, with programs, but then are they working? Are they giving you the outcome that they want, that you were hoping for? So epidemiology also gives you tools to do those evaluations. And that's why I like it so much, is because you can really work on that entire spectrum, from definition of the problem to evaluation of solutions and interventions.
Yeah, and you think about women particularly, which is obviously your central area of focus in your life and your career. As we think globally about this, are you looking globally? Is this one of those things where you're putting a large global lens? Are you looking locally? And are we making progress? And how do you deal with the inequities around the world? And I ask a whole bunch of questions because I think there's a lot here. You go wherever you want to with your answer, okay, which is fine by me. But it's clearly a complicated, ever evolving situation as you think about women and the impact of maternal, and childbirth on them. Right.
So I've studied mostly the populations that I am in. I've studied women in Palestine. I've studied women in Qatar. So, and it's very interesting to kind of compare and to see how, how your findings and your approach compare with other populations. Some problems are unique, others are quite common. And sure, I mean, some progress has been made in women's health for sure, in standards of living and access to care, et cetera. But then there are also a lot of challenges that remain. And I'm glad that you highlight inequity, because, that's a problem not only for women, it's a problem, yeah.
Period. Yes.
The general problem, and it's just one of the biggest determinants of health outcomes. And sometimes people may not appreciate the extent to which it really influences health outcomes. So that's very important to think about, both in defining the problem, but also when you implement interventions. Are people going to be benefiting from them equally, and who's going to benefit and who's going to be left out? So it's certainly very pertinent and very important to always be applying that lens of equity.
Yeah, it really does. And it of course also goes in a certain way, it fits also into the thought about ethics and the broader picture of what it means and how we distribute the things that we distribute. And that's certainly an area too that Salem is going to be focusing on as we make our transformation into health leadership. The thought about the inequities and the ethics and how all of this kind of comes together. So it's fun for me to play with you a bit about that and thinking about what that may mean. You mentioned critical thinking too, and problem solving. Both of those are just kind of things that I think about all the time, because I especially think now critical thinking as we, make so many decisions based on headlines, or make decisions based on social media, or all of the other things that folks may quick decisions on now. Why do you think it's vital to strong decision making? And what advice might you have as to how all of us can improve our skills in critical thinking? Because you have to use them every day in the work that you're talking about in terms of how do you get bias out of the question, as an example, or how do you control for it if you know you can't remove it? All those kinds of things. What's your advice on critical thinking and how to make all of us better at doing it?
You know, I think COVID has given people such a good example of what happens when we don't apply critical thinking, when we accept claims at face value and we don't try to ourselves, assess them and evaluate them. And it's just given such a good example of that with all kinds of information and misinformation that is out there. So I cannot emphasize enough how important it is to begin as early as possible with teaching the critical thinking. It's not something that you start with in college or in graduate school. You need it at the earliest possible years of education, and you can teach children that. You can teach them at every level to start asking questions and thinking before they accept any kind of information and trying to weigh different options. So and to to evaluate the source that they're getting the information from and why might they be saying what they're saying. You cannot begin too early. It's just such an essential skill. I mean, not just in epidemiology, in everyday life for every discipline, for sure.
It's funny when you just said you have to start early. I had a flashback, just a flashback to my dad when I was young. We had the whole World Book Encyclopedia back in the day when, of course, we didn't have access to all the information just at our fingertips that we do now. But we had the whole World Book Encyclopedia. And every time I asked my dad a question, he would say to me, go look it up. That's all he would say, go look it up. He was teaching me at that moment critical thinking. Don't just take my word for it. Don't take your word for it. Don't just look around and think it up. Go look it up and learn the real answer. And I think that may have formed my constantly looking up everything because he had that impact on me as a child. So you're so right.
Right. And to always say, well, how do you know what you know? Right. I mean, how do you know that? And why do you believe that? And it's not enough to say because so-and-so said so, or, I read it on Facebook or I read it anywhere. I mean, even not just on Facebook, even in even in medical journals, even in published papers. I mean, you really have to be critical all the time and not just accepting of any claims and thinking about how that information came about, what could have gone wrong, why did they get to the conclusion they get to. You need to be applying that all the time.
Yeah, and I think that leads us to something you and I spoke about earlier, and that's that willingness to communicate uncertainty as well. When we really don't know, it's important to say one doesn't know, as opposed to trying to lead someone to think something that maybe we really don't know for sure yet. This concept of being willing to communicate uncertainty has really, I think, been clarified a lot to us, the need for doing that appropriately during the COVID-19 outbreak and all that's there. What does it mean to you? Because I think you have a passion around this kind of concept.
Yeah. I do, because I've seen, and I think we all have, just looking around us, I think we've seen the effects of that in COVID-19. I mean, here's this, at the risk of using a highly cliched word, here's this unprecedented event unfolding, right? And in real time, you're watching it and things are happening and scientists are racing to come up with answers and you have new findings every day and so on. The tendency in a pandemic like that, and when people are so nervous and anxious, and understandably so, the tendency is to want to give, these really definitive, authoritative, black and white, clear answers, right? And, if you could do that with absolute certainty, wouldn't that be great? But the fact is, the pandemic was, and it still is, unfolding, and we are learning new things. And when we are not upfront with the public about how much is known and how much is uncertain, you really risk losing their trust. And we saw that, for example, with guidance on masks. First, it was don't wear masks, then wear masks, then right. And so the public gets confused, but they also get highly suspicious, and we saw that also with vaccines. Vaccines are safe, they're not safe, they're effective. So it's okay. I mean, understanding that of course people want as much certainty as possible, but in my view, it is okay to come out and say, this is the best that we know at the current time, and it might change, and to kind of bring the public along with you on that journey, and to kind of expose them to, you know, the behind the scenes, you know, machinations that are going on to get to those guidelines. I think that's really important, because otherwise you risk a distance with the public. And we've seen in a pandemic how important it is to have that public trust. How else would you get people's compliance with guidelines or mandates if you don't have their trust? So
Trust is everything, isn't it? And some of it goes back to that self-efficacy that you spoke about earlier, because so few people seem to be comfortable communicating uncertainty. We feel like we're the experts, so we must know something, or folks won't trust us. And the fact is the exact opposite, perhaps, isn't it?
It's really such a fine balance. It's such a difficult balance, because you do want to, public morale is very important, and you do want to inspire confidence, but at the same time, you know, it has to be credible. Credibility is so important. So, you know, you have to bring along, like I said, the public on that journey, and you have to be able to say, this is the best we can do at this time. There may be things we don't know. It's just so important to bring the public on that journey.
Okay, so I'm going to call you a public health giant, just for the.
Oh God.
I kind of think you are. I really look up to you a lot already, and we've just barely gotten to know one another, but it's really cool, the impact that you're making. And I'm going to ask you to just dream with me just for a second. If you could, knowing what you know and being the epidemiologist with the big picture kind of thinking, if you could wave a magic wand and fix something in global public health right now that would really change our world and make it a better place, what would that be? If there's only one thing that you could focus on, what would that be, and how would you go about doing that?
I could tell you what it would be. I think how I would go about doing that is the multi-billion-dollar question.
There you go.
I think the one thing would be inequity. I think that it's harmful beyond, you know, beyond my ability to describe it. There have been, of course, a lot of reports on social determinants of health and on health equity and on, you know, the evils of inequity and the gaps that people experience in you know, in resources and in access to care and so on. But truly, if there was one thing I could do, that one magic wand, it would be inequity, because I think once people are given those resources and those gaps are, those unfair, avoidable gaps are eliminated, I think everyone can reach their potential, everyone anywhere in the world, and not just people who are born in certain places, in certain settings, in certain conditions, right? I find that just such wasted human potential.
Is there any way, I mean, you know, probably not, you know, on a global scale, could you turn that tide fast enough to satisfy any of us? But any thoughts or ideas about even how to begin or chip away on a more global perspective of doing this?
Join the ranks of public health. I think that's the best way to do it, right? Because this is, I think I told you last time we spoke, public health is a value. It's not just, it's really more than a discipline. It's just, it's your values, and it's your commitment to the world to, you know, to fight that good fight against inequity, knowing that it's going to take more than, you know, one generation to make a difference, and that it's a very long and uphill road, and in some places much more so than others. But I can't think of a better way than educating you know, men and women in public health, and getting them to commit to those values.
Which is exactly what you get to do every day of your life. And
Which is why I love my job.
exactly. And it's exactly, of course, where Salem is going to go with you as well, which is, very exciting for me to hear you say those things, because as we develop a pipeline of women of purpose that are kind of united to improve the health of the world, and a community of women, just like what you just described, one way to go about this is to continue your work and our new work in that way, building women who do that. And of course, we already have. You and several others are already doing that on behalf.
Just so exciting, really. I can't tell you this new direction of Salem.
But it's really exciting. And in fact, one last thing before we go to Salem, and then we'll transition just to Salem. But I do have one last thing, because I think it's very germane to this. As we think about senior leaders in the whole health ecosystem, only 25% of those are women. 25% are women. From your perspective, how important is it that more women rise to these senior levels, and why is that important to you?
Yeah, I mean, almost everywhere in the world, the healthcare workforce is largely feminized. So it's mostly women, right?
About 80%.
Yeah, in some health professions more than others, but it's very much dominated by women. So if they're the soldiers, they also need to be the generals, right? Because they are on the front lines, and they understand the fight, and they're going through it. So they also need to be at the table where decisions are made about how that workforce is managed, and how to create the best possible environment for it to be effective. So hugely important, I think.
Okay, thank you. All right, so now let's turn to Salem. And we're just going to play a little bit here first. So just a word or two about these, all right? So what was your favorite course?
Microbiology.
Microbiology, I love it. Gram stains and all that cool stuff. Okay, outstanding. And what faculty member would you say had the greatest impact on you?
George McKnight, my chemistry teacher.
George McKnight, what a lovely thing to say. I always like to say here when somebody mentions a name, I hope someone watching will ensure that George actually gets to watch this somehow, because I just think it's vitally important when you call somebody out by name like that, they know that you did. So thank you. That's really lovely. All right. And what was your favorite tradition on campus?
Convocation.
Why convocation? I'm going to ask, I'm going to break my normal thing and say, why convocation?
There's just something about the ceremony, the spirit, the candles, just all of it, the way it all came together. And at that one time, you just really feel that the entire student body is one. I loved it.
You loved it. It's also kind of the beginning of something, isn't it? The excitement of getting back together and starting a new year. Yeah. Oh, that's really cool. Okay. You may be the first one to say convocation. It's fun to ask people these.
Probably people said something much more exciting, but
no, I think it's just wonderful. And each time somebody says one, it says so much to me about them as a person, which is just lovely. I think for you, that meaning, I can feel it across the waves. That's really very cool. Really across the waves, long way away.
Yeah, literally.
Really across the waves. That's not my norm for these. I did interview someone in Rwanda and someone in Spain, but I think you take you probably are, well, Rwanda was a little further, but very close. You're a long way. All right. So when you needed a moment to yourself and you needed to go recharge somewhere, where would we have had to look to find you? Where might you be hanging out or hiding out?
Well, I have two places. One is cool, and one I think officially makes me a nerd. So one is Maydale. One is the Maydale for sure.
Okay.
The other is Granley Library, first floor.
No way. So
no way.
Okay. So, but that's not, again, no labels here, my dear. We don't call people nerds or anything. No labels. Wherever you found comfort is what matters. And I think that's really cool, because again, it says you chose that. So it says something about you, and I think that's really cool. And the other one outside, the Maydale. Why the Maydale? Did you go sit by yourself out in the Maydale and just enjoy the beauty as well of that area?
I would do that sometime, and then I remember the day before graduation, I went out with my friends and we just sat there for one last time, and it was just sunny and it was beautiful. And those things, those moments in life that are just kind of postcards that you never forget. That was one of those moments.
Yeah, that's wonderful. Yeah. And so often you don't take time to reflect. So I'm glad this gave you a moment to do that. That's
It
really
did.
cool. All right. So looking back on all of your experience at Salem, what would you say Salem did to prepare you the most for your success, however one defines it, in your work and in your life?
I think it made me feel incredibly supported. And again, I circle back, to the idea of self-efficacy. It just said to me in so many different ways, you can do what you set your mind to doing. There's nothing you cannot do, and everyone here supports you. That's Salem to me in like 2 lines.
All right. And I normally ask folks right now, what would you say is the secret sauce? When you think about Salem and you smile, as you are right now, which makes me happy too, and you smile and something just kind of bubbles up in you that makes you feel that way. What is it about that? What causes that?
I think it's just because you can be whoever you want to be, and you would still get love and support and encouragement. Just being whatever you chose to be. I think that's really what it is. It's very important, especially, at that time of your life, at that age. It's really important to say, you're doing great with whatever it is that you want to do, however you are, and you are supported and encouraged and nurtured.
Well, it's just a wonderful segue into the next question. Put yourself back in that time and then fast forward to where you are today. And if you could write a letter to your 20-year-old self or your 18-year-old self, or to the women who are there now studying at that age, what have you learned? And what would you tell them about how to experience and get the best out of their experience at Salem?
I would say you are at an incredibly special place, and you will know it at the time and you will love it and enjoy it, but multiply that by 1,000,000 years later. When you leave, you will start to realize how much it is that you really got out of that experience there. So live it and enjoy it and be proud of it, and extend whatever you learn there to others as well. Just out of gratitude to just the wonderful things that you receive there, make sure that you extend it to others.
Lovely. And you get the last word on this. So what would you like to leave our viewers with? You've left them already with tons of wisdom, lots of very practical things, lots of inspiring words in my thinking, all kinds of great stuff. But as just kind of that final thought, what would you like folks to take away from kind of your overall wisdom and experience? What would you like to leave them with?
Just to be confident that eventually you will figure out what works for you, right? I mean, we're all different, but we all have it within us. Salem made sure that we all knew we had it within us, and just have faith and trust that you will figure out what works best for you, and then own it and be proud of it, and make a joyful life out of it.
I told you you'd have the last word, so I'm going to let it in there. But I want to reiterate just one word. I can't stand it, and that's joyful. That's come up, I think, in the last 3 interviews that I've had. So there's something about that that's in the air right now. And I thank you for leaving us with that thought about joyfulness. It's beautiful.
Thank you for a great conversation and for just bringing back all those memories to me. Thank you.
Thank you. I don't even know how to say thank you on behalf of everybody who's listening and all of the Salem alums that care about you and care about Salem as we look backwards and forwards to a new beginning.
And forward, yeah.
I just can't thank you enough for joining us. Thank you, thank you, thank you for sharing.
You're welcome. You're so welcome. It was lovely to see you.
All right. So on behalf of everybody, again, we thank you. And to all of our viewers, I look forward to seeing you again for our next version of Salem Voices, which will be very soon, 2 weeks from the time you see this one. And until we meet again, if you'll join me with a little fist bump, we're going to say, Salem
Salem
strong. Thank you.
Salem strong, absolutely.